Welcome, everyone, to another episode of the Jewish Physicians Network podcast. Today, we're honored to host Rabbi Yossi Sprung again, Rav Shari Tzedek, for the fourth episode of our installment on the halachic ramifications of Tishrei for clinicians. Before we start, I'd really like to thank Torah University and Rabbi Kripka for being such excellent partners in this project. Rabbi Sprung, you need absolutely no introduction from us. All our members at this point know you very well, but for any new listeners, Rabbi Sprung is the Resh Bis Medrash of the Beis Medrash Gavoa for Medical Halacha and Technion University. He's also the Rav of Shari Tzedek Medical Center. So without any further ado, Rabbi Sprung.
Thank you very much for the introduction. And today, this is the fourth session. We're going to continue about Hilchos Yom Kippurim, and today we're going to start talking about medicines and taking different pills and things like that. So I'm just bringing up the things that one physician or one that needs has to think about, and everything. It's not going to be clear halacha for everybody, but these are guidelines to check and see what you have to know about it. So first of all, I think when somebody takes medicine, and so medicine itself is not kederech achila, and you could take it. But lichatchila, one should try to see with his physician to see if you could take the pill before Yom Tif and one after Yom Kippur. That is the preferred. But if you can't, so you could take it preferred without water. If you can't, so you should take it with bitter water, bitter herbs, or with a or taking it with a like I think I said it in the past. You take a lot of tea bags and you make it very bitter. All these type of things. These are the things that you could swallow the pills. So that is that. But it's not considered to be food. There is medicines that cannot be taken on an empty stomach. So because they could be right? It could affect the digestion of the person. In such a case, so one could think of eating the shiurim, not necessarily drinking. Okay, eating the shiurim, and also just what he needs for those medications. And obviously, we're talking about medications that are dangerous not to take. So I'm just saying, what are the questions that you have to look into when you talk about medicines? What if you could skip? You can't skip. Can it be on an empty stomach? Can't be on an empty stomach. Could it be without water? Or if the person does not know how to take the medication without water, so he could take it with water that is pagum, meaning bitter, and is not roi le'achila. Now we are going to continue, and we're going to talk about different sicknesses. So I want to focus now a little bit guidelines regarding diabetes. In diabetes, there is a lot of type of diabetes. And one of the concerns that we have in diabetes is that we are afraid of that the person will dehydrate. Especially when he has a high sugar, when the sugar is very high, so he could dehydrate. On the other, when he has when he's hypo, so that is also dangerous. Not only that, a lot of times the ones that have the what's called the senior diabetes patients have a lot of other problems, and therefore you have to be very careful. They have heart conditions, they have problems in their blood vessels, etc., kidneys function. So therefore, all these things have to be taken in consideration and see if they could fast or not, if they could drink, if drinking the shiurim is enough for them, and that all of that. Now, when we talk about diabetes, we have to see if the person is not balanced, then it's very, very dangerous. And the doctor the doctor that knows him has to see how to balance the food and the drinking with the medications. There is people that are balanced, type 2, that are balanced with a special diet. So they're most of them probably could fast. Again, very carefully, you have to see it with the doctor. But as a doctor, you have to see how to balance it in such a way, not shown to balance. A lot of times you have people that are balanced for years and could tell you that. I'm telling you from experience. I saw someone like that today, and he thought he could fast because he said, I have diabetes for years and years and years, and I was able to fast. But the doctor told me he is suffering from some type of a infection, and that basically caused him not to be balanced. So I explained to him that your status now changed, and in order for us to enable you, Be'ezus Hashem, to fast a lot of years this year, you have to think and you have to understand that you're not allowed to fast. Insulin, okay, all of these things. I think the doctor has to sit and see how exactly to play with the insulin and the food. As I'm saying, it's very dangerous to play with these things, but as physicians, you could try to see to enable these people in certain cases. Again, if you know that you could rely on them and you know the patient in person, and you could try to change the level of medication or insulin or things like that, that is a option. Now, another case of that's clear that anyone that has hypoglycemia in the middle of Yom Kippur, don't start with shiurim right away. You have to give him something sweet, whatever they give them, and not to give them shiur. What's with blood? The blood testing for people with diabetes. So today there's a lot of modern devices that you don't need, but there is people that are still with the old devices. And there, the question is like this: L'chura, using such a device without doing it b'shina or something like that is an isur d'oraisa of taking out blood. So, is it better? Maybe the question is, maybe it's better for him to drink or eat l'shiurim and not poke himself a few times a day in order and be over an isur d'oraisa because of pikuach that it's mutter because of pikuach nefesh. But here he doesn't need it if he eats the shiurim, so you won't be needed to do it. So that is a shir by itself to go through the halacha of it, because that is very through the whole sugya of it. But halacha lemaisa, when it's clear, so a person better eat the shiurim than do it in such a way. But in certain cases, when a person normally could fast, and if he doesn't feel good, he may come to a situation that he'll have to test himself. In such a case, I would say he could fast. And if he has some type of, meaning I'm saying a person that normally is okay and he knows that fast is not so bad, once in a while he had maybe cases of hypo or something like that, and also it wasn't it was 60 or something like that. It wasn't so low. I mean, it's low, but not a lot less than 70 or something like that. In such a case, I would say he can fast, even though he knows that he may have to use the blood testing. So if I want to just explain this again, if you know clearly that by fasting you'll have to poke yourself a few times, then better eat b'shiurim. But if you don't, if it's not clear, then you're allowed to fast. Okay. The next topic I want to speak about is a stroke. A person that had a stroke. So there, the main concern that we have by a stroke for a while after is that a person is going to dehydrate. And therefore, a person that had a stroke, I would say in generally, for the rest of his life, he has to consult his doctor that knows him if he could fast or not. That I would say is for someone that had a stroke, meaning it's not so simple to give him to fast. The doctor has to think the whole time, is he someone that, could have a blood clog or something like that, etc. In general, infections. So if it's infection that is with comes together with fever. So if it's high fever definitely is a danger that could cause someone to dehydrate. And in such a case, he's considered to be choyle sheyesh bo sakana. And if he could handle shiurim, he could. That's okay. Antibiotics is not necessarily an answer not to fast. Again, a lot of people could fast with it. A lot of times you could take the antibiotics in the evening, after the fast, before the fast. Again, the doctor, you have to consult the doctor if it's possible or not. Someone that is taking antibiotics after he's already under control, meaning his infection is under control, he is still considered to be a choyle she'ein bo sakana, and that is we should know. Someone that has breathing problems, okay, so in such cases also he has to drink l'shiur. Crohn. I'm not going to go into all the different Crohn's, but I want to say something that I had a conversation with Professor Don Turner. He's a world-renowned name in these type of things, and he claims that in certain cases in Crohn, we're talking about Crohn that is controlled, certain cases, fast is even healthy for them. So I just brought that because I thought that is a Chiddush. Okay, migraines. It's known that fast is a big cause for migraines. So this is interesting. In general, migraine I would say, is not a dangerous situation. It's definitely very disturbing and it's difficult, but it's not. Most migraines are not dangerous. So therefore, I would say that we are mitzuvah to fast. We are commanded to fast, and I don't think we have to feel good. If we don't feel good because of the fast, maybe that is part of the reason of the fast. So migraine is not a sakana, and therefore a person is not allowed to eat and drink. Better, person should rest or take even a pill or something like that. And he's allowed to take pills for that and not to worry about Isur of Shchikas Samemonim. If a person wants to take medication in order to prevent a migraine, so again, if he knows that he has these type of things, so he's allowed to take that. What happens if someone has migraine, and there's a lot of people that have migraines, and because of that, they start to vomit. So there we have to be concerned again of dehydration. So there we have to be very careful. If there is a chashash of dehydration, he should drink the shiurim if it's possible. Real bad migraines, I think that has to be consulted with a doctor. Bariatric surgeries. There's people that have bariatric surgeries. Usually in the beginning, right after the surgery, it takes the main problem that the people have. First of all, the trauma of the surgery itself. Now, it's interesting. I heard it from Mari Rabbi Agon Rosh said it a few times. At Chazal, we don't have sources regarding generally surgeries and Yom Kippur. So the only trauma that we have in Chazal, that real stress for the body, is labor. Now, in medicine, it's harder for us to understand how labor is so stressful for the body as the way Chazal understood it from the medical point. But in Chazal, halachically, they look at it as something very stressful. So definitely we could compare surgeries to a birth, and therefore the first 3 days for sure a person has to eat and drink regularly. And after that, everything is according to the need, whatever the doctor thinks. So therefore, I'm back to what I said before, bariatric surgery. So the surgery itself, it could be for a while, okay, so that he cannot fast. But the problem is there's another problem, that since they're not able to prepare themselves well enough for the fast, because they can't drink a lot or eat or something like that. So in such a case, at the beginning, they definitely have to first of all try to prepare themselves as much as they can. And in the beginning, the first Yom Kippur, I would say, if it's 2, 3, 4 months after, they should drink lishiurim. Definitely should drink lishiurim. But here again, these people, probably it's better for them to stay in bed and try to keep their liquid in the body, if that would enable them to fast. And that I'm saying as a general rule. Anyone that, if he rests in bed, will be able to fast, that's more important than going to daven in shul. Inui, fasting, is the main mitzvah of the day of Yom Kippur. Even though everyone wants to go to shul, everyone wants to daven, no question about it. But definitely the most important thing is to fast. So you have to balance and see what is the right thing to do. Someone that has serious burns definitely is something to be of concern, that he has to have a lot of drinking because of dehydration, and there in a lot of the cases shiurim is not enough. Heart diseases, different heart diseases. There, it's definitely very, very, very important to prepare yourself with your personal doctor. And there, it's not somebody to come to the doctor a day before Yom Kippur. This is something that has to be real concern. Someone that has heart failure and he is balanced through medication, he's probably not allowed to fast. Most of these medication cause a person to have to urine a lot, and therefore it's dangerous for his kidneys. Arrhythmia is something that has to be checked. This is something, if he's balanced, he's not balanced. And common attacks, it's not common attacks, or he has a quick pulse. All these, someone that has a quick pulse or common attacks definitely is usher for him to fast. But otherwise, the question is if he is balanced or not. Pacemaker, after a while, if he recovered from the putting in the pacemaker, l'chura, there's no reason not to fast. This is interesting. Catheterization. Here there is different opinions. There is ones that say 3 months after you can fast. There's ones that say, doctors that say up to a year. Here also you have to take in consideration the kidneys function and the hemoglobin of the patient. So here, I don't know what to say. Every doctor, according to what he knows, or what he thinks, this is something that we have to be very careful. 3 months after a heart attack, definitely a person cannot fast. But again, as I said, the doctor has to know him, because what's the level of attack that was there and what was the damage? All of these things are very, very important. Obviously, people that have defibrillators, ICDs, these things, I can't say a general rule. It has to be why do they have that, and what is the general thing that they are suffering from. Now, let's talk a little bit about cancer. In general, to say that anyone that has cancer cannot fast is not the right, it's not true. Cancer is a terrible disease, but today you have people that know that they have cancer or beginning of cancer, and they're starting, they have metastasis and that are growing in their bodies, and therefore, but they feel okay. In such a case, they are allowed to fast. They should fast. When we talk about someone that is going through chemo, so after speaking with professionals in that chemo, there's a lot of different types of chemo. There's chemos that are toxic and are dangerous for the kidneys or for the digestive system. In such a case, they should not fast. But otherwise, a lot of people that, even though they're going through chemo and they're okay, if they are strong enough and they're not weak, there is a tzad to say that they could fast. So the difference is if it's not toxic to the kidneys or to their digestive system, so then if they could handle a fast, they should fast. Radiation. Most radiations are okay, even if it's to the prostate. Most doctors that I spoke to would say that they could fast, unless the person has other problems and he loses a lot. He dehydrates because of other reasons and things like that. There, he doesn't have to. So there, they have to fast. But for example, if somebody has in the middle of radiation on his vocal cords or something like that, in most cases, probably he cannot fast because they could dehydrate. Again, hormonic treatments. Most hormonic treatments, people could fast, but here we have to be concerned about the age of the person and side effects. Someone that went through surgery of taking out a tumor or something like that. So in general, probably on that, I would say most cases cannot fast up to 6-7 weeks after that. But if it was a small melanoma or something like that, so again, doesn't mean that he cannot fast. So I would say, in general, I wouldn't say that somebody that has cancer, any type of cancer, cannot fast. You have to be concerned and see which one yes and which one are not. This is very, very important. People go through cycles of treatments, and if they fast on Yom Kippur, if that would be a reason that they won't be able to take a treatment on Tuesday, Wednesday after Yom Kippur, so definitely in such a case, they should not fast, because that is, again, putting their life in danger. In general, we do not postpone, even for mitzvahs and even for Yom Kippur, we do not postpone treatments because of that, and therefore we don't do that. Let's talk a little bit about mental health. So just general things. In general, in a general, I would say that people that are balanced, and they worked very hard to balance them, eating and drinking, not eating and drinking, the stress a lot of times could be a trigger for basically ruining the balance that they worked for months to get to. And in such a case, they could really be very dangerous. They could be in deep depression, suicidal, all these type of things. So therefore, that is something that the physician has to think about, even one day. Lithium or these type of medications, they're known to be dangerous for the kidneys. So there you have to think about, to be concerned about drinking. Now, drinking the shiurim, that is something, if you could rely on the person that he could drink the shiurim, not in every case that in these type of illnesses, it's possible. As I mentioned in past shiurim, people that have eating disorders, okay, anorexia especially, no question not to talk about shiurim. Whatever they could drink or something like that, anything like that, they should drink. Now let's talk a little bit about pregnancies. The halacha, the Shulchan Aruch state that mubaros misanos umashnumas b'Yom Kippur. A pregnant woman has to fast on Yom Kippur. And even though most places can say, even though women today are weaker than the times of Chazal, but still the halacha is that women have to fast. What happens to women that are very weak? Okay, so here we have to understand like this. What is the Seder Advarim? First of all, as I said before, the most important thing is to fast. So therefore, if the price that a woman has to pay in order to price is to stay in bed, and the price is that her husband has to stay home and take care of the children, and both of them are not going to shul, that is a price that a couple should pay in order to fast. Yes. Again, if you have any other way to help, so that's okay. But I'm just saying, even such a price is important in order for enabling, and again, always to try to prepare good before. A woman that is pregnant has to understand that already today, she has to be concerned about Yom Kippur and try to prepare. Not always it's possible, especially if she loses a lot of fluids and throws up or all these type of things, but she should try to do that. A woman that now we have to divide it to two parts. There is dangers because of her situation in the pregnancy, and there is also things that are caused because of beginning of birth. And there we're concerned more because of the early birth. But that is only people that have history, women that have history with early births. That is that. high-risk pregnancies. Every case like that, you have to consult the doctor and see what to do, to eat the shiurim, not to eat the shiurim, to eat regularly. That is something that we have to be concerned. Low hemoglobin. Now here, this is changes like this. If we talk about the first 2 trimesters, so if she goes up steps and she feels right, and then she cannot get back her breath quickly. So if she rests and 10 minutes after that she cannot get back her if she could get back her breath pretty quick, so that's okay, then she could fast. But if not, then she has to consult the doctor if she could fast or not. But if she has serious problems of the sapenia, even when she is sitting down, so that is something to think if she has to go to the emergency room or not. If we're talking about the 3rd trimester, so there we have to be concerned of a beginning of birth, and there also we have to see what we could do in order to stop contractions. Anytime that the main thing that we have to be concerned is to see if she feels dizzy or weak. All of that is something that if she has those signs, she has to drink lishi urim. High blood pressure. So if it's high blood pressure that was is caused during pregnancy, so we are concerned about toxemia. Therefore, okay, in such a case, if she's hospitalized, in such a case, I would say to drink and to ask the doctor if she has to drink not l'shurim regularly. And why am I saying to ask the doctor? Because in such a case, she in seconds could be in a maybe go into labor, and we do not want her to come into labor dehydrated. On the other side, the doctor has to see, because could be shiurim would be enough, and if things go out of control, anyway, she'll have a C-section. So I'm saying these are the things that you have to be concerned. Someone that has high blood pressure before the pregnancy and during pregnancy should take, of course, the medicines even on Yom Kippur. But as far as she doesn't have the symptoms, if she's okay, she could still fast. But if chas shalom she has headaches or any dots that she sees in her eyes or things like that, or pain that comes from the liver, all of that are signs for toxemia, and that is very dangerous. Someone that has already toxemia, as I said before, probably cannot fast. Okay. Now, the last topic that I want to talk about on Yom Kippur, and that is IVF pregnancies. There is a sefer from Shlomo Zalman Auerbach that says that IVF pregnancies do not have to fast. Again, in the beginning, the first few weeks, it says not to fast. That's a very, very, very big chiddush. So I want to just make, it's a short say that is brought from Shlomo Zalman. Nobody explained what exactly he meant. So I want to say like this. Women that are took medications, right, in order for stimulating their ovaries, in such a case, the danger is of dehydrated, to dehydrate. So if we're talking about before putting back, just to stimulate the ovaries, okay, and after putting back, okay, after putting back, in such a case, they have to drink in order not to have OHSS, and that is right, not to have ovary hyperstimulation syndrome. And in such a case, we have to be very, very careful. But when the reason of IVF is just because of PGD reasons or problem with sperm or things like that, or frozen embryos. In such a case, so we don't have the concern of OHSS, but that is a big chiddush that I heard from a doctor yesterday, and Rabbi Weiss agreed with that lahalacha, and that's a tremendous chiddush. That in the beginning, after putting back the ovaries, this doctor said from his experience, he's concerned that the stress of the fast would affect the pregnancy to establish, and therefore he would say the first 4 to 6 weeks she should not fast. And the chiddush is, even if we're talking a day or 3 to 5 days after the putting back the ovaries, so maybe it's not yet considered to be a pregnancy. So I would say, and here we're not doing it because of the health of the woman. We're doing this because of the health of the fetus. But is that considered a fetus? Yes. The chiddush is that yes, since it is already, once they put it back into the body of the woman, so it starts to nourish from the womb, and that nourishment is already a beginning of, I don't know if to say a pregnancy, but the reason that it's mutter for us Mechlal to be Mechal Shabbos and to do anything to save pregnancy, any type of pregnancy, is because of Chalil of Shabbos Achas Kedei Sheishmor Shabbosis Arbe. So the chiddush is here, even though you could still even wash it out, in such a case that could be used for reason to at least drink the shiur. I just want to talk a few halachas regarding sukkah. Okay, very important. Somebody that the first night of Sukkot, okay, if there is a sukkah in the hospital, you should know, and you're in the middle of a shift, you have to remember that there is a halacha of eating kazayis besukkah. We learn a zera shava tesvav from Chag HaMatzos, and the same way a person has a chiyuv midoraisa to eat. Okay, to eat a kazayis matzah in the first night of Pesach, the same thing, a person has a chiyuv to eat a kazayis of pas in the sukkah. So therefore, someone should find time to eat a kazayis even in the first night. And why am I saying it? Because the halacha is that someone that is a mitzvah, he is poter min sukkah, meaning if I am basically busy in helping a sick person, and anyone that is helping him and is serving him and doing anything to take care of him, is poter min sukkah. Why? Because they're occupied, and their whole mind is very occupied to take care of them. So for sure that a physician and any nurse and anyone that is taking care of, and a family member that is in charge of the medical procedure, they have a p'tur of cholim mishamshem, and in halacha they explain that is also part of mitzvah, that it's poter. But does that, even a mitzvah, the halacha is that has to eat a kazayis matzah. So if you are in a hospital that there isn't a sukkah, so you can't eat, what could you do? You're an oinus and you're poter. But if there is some type of way to do that, better to do it before Chatzos Halayla and to make a bracha of leisha basukah. But if you do it after Chatzos, so in order to make a leisha basukah, you have to eat a kabetza. Kazayis is not enough. Kabetza is more than a kazayis. After Chatzos, so you already lost the opportunity of the mitzvah of kazayis, and therefore, in order to make a leishev, you have to eat more than a kazayis matzah. In general, I want to say that as I say, I want to say, first of all, Stam, you should know that an oinen, if you have any case of an oinen, you have to tell them that they are pturim mitzvahs sukkah. Even though one could say, what's the problem going into a sukkah? The answer is you have to be busy in doing what you're doing, and therefore the sukkah is not is potter. A choyle, okay, is potter min asukkah. But when we talk about a choyle she'ein boy sakana, so there he's potter min asukkah only if sitting in a sukkah makes it, that causes him it's hard for him. The yeshiva sukkah, the lashon of the Shulchan Aruch yeshiva kosher loy, then he is potter. But if it's not kosher for him, so he could sit in the sukkah and make a bracha. And as I said, always he should sit in the sukkah laila rishon and for kazais. B'choyle sheyesh bo sakana does not have to do that. A doctor has to be concerned for a patient if a sukkah is dangerous for him or not. And if a doctor tells a patient that it not to sit in the sukkah, so the same way we try to explain to people that fasting, not to fast on Yom Kippur, this is your mitzvah this year. So the same thing here. If you think that that is dangerous, also you should explain to him that your mitzvah this year is Teishu Kein Taduru and to eat at home. This is what I have to say for this session. And Gemar Chasim Tova.